All right, welcome everyone to the Board of Health meeting Thursday, June 23rd. Could everyone please rise to salute the flag? United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So, good evening. Welcome to the June meeting, the Revere Board of Health. My name is Dr. Drew Bunker. I am the chair of the Board of Health. Joining me tonight for tonight's meetings are board members Dr. Craig Costanza. I think Neza Luadi is our other board member. I think she's on the way. Attendance for tonight's meeting are City of Revere staff Lauren Buck, who's the Director of Public Health, Michael Wells, Director of Municipal Inspections Health Agent, Paula Sepulveda, Board of Health Clerk. So tonight's agenda, first thing we're going to do is review and approve the minutes from May 26th meeting.
I approve.
Yep, I approve those minutes as well. And then next is going to be the Public Health Communicable Monthly Report.
Thank you. So I'm going to direct your attention to our non-COVID communicable disease chart. Our influenza cases are trending down over the last month, which is a great sign. I would just want to bring your attention to the second line down, which we had a 40-year-old revoked monkeypox case. Obviously, I wanted to bring this to your attention because monkeypox has been in the news a lot lately. This case was ended up being revoked. So it was reported by, the case was reported in a high-risk individual from a primary care provider. The case presented with questionable symptoms, and it was reviewed by the Mass DPH epidemiologist. And it was concluded that the questionable symptoms, which was a rash, was not characteristic of monkeypox, and therefore it was revoked. Obviously, I'll continue to update you if we see any more cases come through Revere and what happens. So this was a revoked case, but I just wanted to make sure that you were aware of that. We have so our tuberculosis cases this month, we still have one current active tuberculosis case. The case is doing very well on treatment and is almost nearing the end of the treatment course. No other real important notes from the CDC this month. And then a just quick review of our COVID cases as of June 21st, 2022. We have 23,522 confirmed cases. We have 182 deaths. That's one death increase from last month. Our 7-day case average is 13.1%. This is a huge decrease from last month. So we're definitely on, we think the downswing of a little kind of blip of a surge that we saw over the last 2 months. Our 14-day positivity rate was 8.8. Again, this is a downtrend. We were in the 10s for quite a long time, and so we're trending down. Just always keep in mind, the positivity rate is always testing PCR tests. Many people are testing at home. This positivity rate does not catch that, so just keep that in mind. And then our vaccination rates, we've increased in every category, some very slightly, some more than others. Our 5 to 11 vaccinated rate is still pretty low. It's 43.9%, but again, we are increasing every month, and so hopefully that trend continues. Anyone listening in, I always remind people to go to revere.org to see our lists of our weekly vaccine clinics that we still continue to do, we'll do throughout the summer. There's been some news about the under 5 category in terms of vaccines. Always look on revere.org. We will be hosting clinics that will serve that population. Please look to that resource if you have questions. That's it.
Great, thanks. Next will be the Inspectional Services Monthly Report. Before that, I just want to also welcome in attendance from the Mass Municipal Association, DJ Wilson, Lisa Stevens, goodnight, and from the Six City Tobacco Initiative, Bonnie Carroll. Thank you. Sorry, Michael, go ahead.
Thank you, Dr. Bunker. This is a new report that we'll be sharing on a monthly basis, and these are the statistics from the Health Inspections Department under municipal inspections. We have 3 divisions. We have interior housing, we have food inspections, and we have exterior sanitation. Interior housing this month, they performed 28 certificates of fitness, 5 certificate of fitness re-inspections. Certificate of fitness is making sure apartments are habitable for rental occupancy. Interior complaints, we had 6, 1 reinspection on interior complaint re-inspections. We had 6 pool and spa inspections and 8 re-inspections on pool and spas. On the food inspection division, we had 18 routine inspections, 12 re-inspections, 4 complaint inspections, and 3 pre-opening inspections. On the exterior sanitation side, violations issued this month were 21 for accumulation of trash and litter, 215 for improper placement, 52 for unclean, unsanitary, and overgrowth. 7 violations were issued for working without a permit. 9 were exterior junk heaps, and 37 for improper bulky item storage. That's all I have.
Great, thanks. So the next thing we will talk about is the request for appeal. This is, I believe this is ABC here today. This is the store that's on 170 Revere Street, and they're appealing a fine and suspension from April 11th. And we'll have you guys come up. Thanks.
Good evening, Dr. Bunker and members of the commission. Jared Hockman.
Steve Carnelali.
Jared Hockman on behalf of ABC. Okay. You don't need Steve. And Ms. Buck, Mr. Wells, nice to see you tonight as well. Before we begin, I'm not certain. I have the April 11th correction cease and desist order, and I understand this is alleged to be a first offense within a 3-year period, so I understand the fine to be $1,000, and that's, the CMR talks about that very clearly. And then it indicates, in addition, your business will incur a suspension to be determined of the license to sell tobacco and nicotine products. What is it that you're seeking? Before I even say that we're appealing anything, I don't know what the term of suspension is and what the breadth of that suspension would be.
So it's a 3-day suspension.
Sorry, if I may, through you, 3-day suspension of what?
Of the tobacco license.
Of the ability to sell all tobacco products or cigarettes?
Can Bonnie go to the, do you want to go to the mic and just say it on mic? I'm sorry. Do you want to go to the mic and just say it on mic, yeah?
Sorry. Yes. I shut it off. Okay, a 3-day suspension of the ability to sell any tobacco products.
I thought, Miss, I do have some, maybe you can help, if I may, yeah. So is it a 3 consecutive day suspension, or is it a 3-day suspension to be served over a period of time?
It's a 3 consecutive day suspension.
Okay, thank you.
You're welcome.
So that's where my client has engaged me to appear before the commission. And Dr. Bunker, you were actually quoted in a recent article in the Revere Journal saying, we know it's a hefty fine, but we have a responsibility to enforce the law. And I agree with you. You do have a responsibility to enforce the law, and this provision is serious, and the matter is serious, and we're not taking that lightly. However, if you look at 105 CMR 665.045, where it talks about violations of this particular provision, it states the following fines and actions apply against any person who violates 105 CMR 665.000. 1, in the case of a first violation, a fine of $1,000 should be imposed. That's what the regulations say. And they go on to say, in the case of a second violation within a period of 36 months from the first violation, a fine of $2,000 should be imposed, and a prohibition of the sale of tobacco products may be imposed for at least 1 day and up to 7 consecutive days. So now here, my client is, and then it goes on to the third case, which is even a more serious penalty, but not necessary by way of example for this hearing. So my client is here on a first offense. That's not in dispute. And what I don't know if it's the Board of Health or the the regulatory agency that is here today is seeking a suspension of a license that's greater than what the legislature and the CMR has enacted in the statute. So we're fine paying the fine. And I think that that's what the law requires, right? That's what this 665.045 says. In the case of a first violation, a fine of $1,000 shall be imposed. And we know that the CMR was written with the understanding that a suspension or a prohibition of sale could take place because it's not only contemplated, but it's stated in the second and third offenses within a 3-year period. So in addition to that, I think that there's an equal protection argument that my client makes. My client is a tobacconist. That's their sole item for sale. It's not a convenience store. It's not a liquor store that sells cigarettes and has other items to sell. My client is, the business is owned by a 90-year-old gentleman who's been in business here in Revere in the same location for 49 years, and we're talking today about the first offense of this particular provision, which, again, for purposes of today, we're not arguing. We're not arguing the $1,000 fine. We'll write the check to whoever the check needs to be written to and move on. But closing the business, and you are actually closing this business for 3 consecutive days for a first offense in 49 years, when the CMR doesn't require that. So I want you to follow the law. Now, I'm an officer of the court, and I'm not. You guys know the CMR better than I do in this provision, at least. It also talks about that later on in the CMR that there is the opportunity where the local Board of Health may impose a prohibition or a suspension of license. But it's not obligatory. It doesn't say shall. It says may. And what I'm asking you today, what my client is pleading to this board is that in 49 years, we're here for the first time. We think that under the circumstances where 99+% of, there is a soda case in the store and there's a small candy display for people that come, no one's coming in for the soda and candy. People are coming in generally to buy cigars, not so much cigarettes. Their cigarette sales are slow. So if you wanted to suspend their ability to as an alternative, their ability to sell cigarettes for 3 consecutive days, we can concede that. But their ability to sell all tobacco products for 3 consecutive days shuts them down for 3 days. We all know how difficult it's been for small businesses in the last few years due to no one's fault here. It's just the way it's been. It's the reality that we live under. And to close them down for 3 consecutive days, I submit to you, is not what the CMR and the statute contemplated in this instance. What the CMR actually states is to fine them for $1,000. And like I said, we're not happy about writing a check, but we'll write a check. So for those reasons, I ask that the board follow the law. Follow the law, issue a fine of $1,000. The probation period is a long period of time. It's 3 years. It's 36 months. That's a long period of time. Any further violations of this provision, I'm not going to be here before you saying don't suspend them, because the CMR actually says, there's a possibility of suspension at least. So for those reasons, I ask you to impose the fine of $1,000 and nothing more, and allow these folks to continue on with their business. Thank you.
I'm just going to ask Bonnie to come up here. Thank you. Because just have some questions for her for some clarification.
I'm going to defer to DJ Wilson, who's my legal advisor at NTCP, to show the part.
Awesome.
I'm sorry, I'm going to defer to DJ Wilson to show you the part in the law, which is why we have the 3-day suspension.
Right. So what ended up happening, to give you a little history, and it is understandable that you missed this, is that after the state law was passed, it instructed the Department of Public Health to put together its own regulations. So that's what they did, and that's the CMR he was referencing. And so there's a violation section which is set up normally. It's not complicated to read. Unfortunately, for the store, is one step above that in .040, which is entitled Requirement for Retail Establishments. And it took us a while for us in in tobacco control define this. It says, sale of a tobacco product by a retail establishment to a person younger than 21 years of age shall result in the retail establishment being prohibited from selling tobacco products, which is defined in both the CMR, local regulation, and the law, state law, as also e-cig, as vape products. Products for up to 30 consecutive business days. So it does. So what we learned is that this does mandate cities and towns to give out that $1,000 fine under .045, but also a suspension under .040. And so what we've been talking to our local programs, to which Bonnie runs one of them, is to say, while a city or town can certainly go up to 30 days if they like, it makes sense if most cities and towns have a second violation that has a 7-day suspension, that makes sense to have that. And so 3 days is the most popular for cities and towns that do this. I just learned today that Boston chose 3 days as well. Because then it becomes very clear to the store what's happening, it's clear to the Board of Health what's happening, but it does ride just above the violation section, and that's why we missed it and this gentleman missed it.
Thank you. I'm not sure that I missed it. What I'm saying is that there's a section that specifically talks about penalties for violations. And that provision that I don't know if that the gentleman just spoke of is not contained within that section. So, I mean, the way the CMR is written or statutes are written, there's a definition section, and I understand what tobacco products are because it's defined in the definition section. There's a violation section, and it talks about the penalties. And there's a reason for that, so that we understand what the local boards are going to impose for a violation. And in fact, the citation that's issued to my client says you're hereby ordered to pay $1,000, and then in addition, your business will incur a suspension to be determined by the Board of Health. To say that there's going to be no discretion by the board, it doesn't say that there's a 3-day suspension. If that's what the practice is, and that's what this gentleman just testified to, write a 3-day suspension in there. But that's not what it says. That's not what the CMR says. So, let's, doctor, is it Laduti? I'm sorry. Lawadi, I apologize. Let's follow the CMR. Let's impose the penalty of $1,000. That's what the violation section says. And even if there was the desire to issue a suspension, I again suggest, under an equal protection argument, that shutting someone's business down, I don't think is what was contemplated here. I think that there was the contemplation for this provision, this statute, these regulations, was to impose a financial penalty on a business owner that violates it. It's not to put them out of business. So in an instance where it's 10% of the sales, tobacco is 10% of the sales of a particular store or a particular business, and you suspend them for 3 days, that's not as severe as someone who makes 99% of their sales or income from the sale of tobacco. So the disproportionate manner in which you, depending upon what you do, you may impose that sanction upon my client is something that is, I think, over the top. I think it's more than necessary to convey the message that this type of activity isn't acceptable. They understand that $1,000 to a 90-year-old couple is a lot of money. And like I said, they're not contesting that. I'm not up here coming up and creating some story about what the transaction, how it occurred. We're not doing that. We're not trying to play games with the board. We're not trying to make a farce about this. It's a serious matter. But suspending a license like this for 3 days is, I just think, unduly harsh.
No, and I thank you for, conveying that message. And I think we at the board, obviously, as I've said before, understand that this first offense that is $1,000 and what comes from a 3-day suspension is a lot, but we do have to understand the gravity of what did happen, which was a tobacco product was given to a minor. And as a physician who takes care of patients even as young as 16 years old, 17, based on my license, when you introduce tobacco in a kid that young, it can be very detrimental in many ways and can lead to, long-term addiction and things of that nature. So part of the provision is because of the severity of what we're dealing with here. And these are children that we need to, minors that we need to protect. And it's our duty as the board to protect these minors. And this was only a snapshot. I mean, this was one kid coming in. How do we not know that this is happening continuously in other instances? So it is harsh, I understand that. At the same time, we voted as a board to do the 3-day in accordance with some other cities. Boston, obviously, we were given the opportunity to do a 30-day, and we had talked about that, but we thought that the 3-day was acceptable at the time. But I understand that that's, as a business that's major product is tobacco, that's a huge thing. I think from the law that was discussed, it sounds like we are protected to enforce that regulation. So I hear you that it doesn't seem like it's necessarily said in that 3 days suspension, but I think we are protected to make it the board is protected to make a determination and kind of follow through with that determination. I believe so. I mean, I want to follow the law. I don't want to do anything that's against the law. But yeah.
If you're, and I don't know what local vote you took in regard to having a mandatory suspension of 3 days for a first violation. And I don't know what that looks like. I don't know, I don't see that contained in a city ordinance here in Revere. I don't know where it's codified. I suspect that you've done it somewhere, and I can work with Ms. Buck in terms of finding that to read through it. And I don't know if it says that the suspension needs to be on consecutive days. But if it doesn't, I would ask if you're going to impose a 3-day suspension. And while we can respectfully disagree, we do it respectfully, and you're the board for the reason. I'm here advocating for a client. But if you didn't vote that the 3-day suspension be on consecutive days, I would ask that the suspension be served over perhaps a 60-day period or a 90-day period, so that maybe 1 day a month they're literally going to shut down. I mean, they're going to. I know that the CMR also requires them to surrender the tobacco products. I don't know how feasible that is. I think locking the door, I hope, would be something that would be agreeable to the board rather than carting out all of their inventory, because it's a substantial amount and would take substantial efforts to do that. So I guess at this point I would ask those two things, that the suspension be over a period of time. And just to respond to this could be happening every day. It could be happening every minute of every day, but this is the first time we're before you in 49 years. So I suspect that over the course of 49 years, even though I don't think these controlled buys occurred 49 years ago, they certainly have been happening for probably at least 20 years. And this is the first time we're before you. So any speculation that this is the activity that takes place in the store, in this store, on a regular basis, I think, respectfully, again, is a little misplaced. This sale took place at 8:43 in the morning on a Sunday. And it's not like, I mean, I'm suspecting the clerk wasn't through his first cup of coffee and maybe had a long night the night before. So for those reasons, I asked for at least that degree of leniency. I understand that from what you're saying, that you're going to impose a 3-day suspension. Again, I would argue, at least for the record, that due process, equal protection isn't really being served here. You're taking 100% or 99.5% of a small business owner's income shutting him down, as opposed to maybe 10% of a convenience store or 10% of a liquor store's business away.
Absolutely, yeah, I just have to, the clarification, I have to look back to the minutes in terms of if it was consecutive days. I believe it was, but we may have to get back to the minutes to check that in the recording.
I'm just going to say, I don't think we specified.
Did we not specify?
I don't think we specified.
Okay. So I think, without specification, I think, yeah, and then would have to kind of, we didn't specify. So unfortunately, I think we have to, take the fact that it just needs to be 3 days over some sort of period. I don't know what the period would be, and that's something that we'd have to vote upon in the board. But I think we should clarify going forward that it's 3 consecutive days. But you do bring up a point.
So just one thing, I
Yeah.
can clarify that we did not specify.
Okay, we did not specify. So that, I think, for the record, we should specify that it is 3 consecutive days, but because we did not specify, and this gentleman is bringing it up, I think we have to allow it not to be consecutive days, and then would have to specify then a period. And I think the 60-day period is a reasonable period, just given the fact that we do apologize for not specifying, and then that we accept, the 60 days. I'm just gonna, is the board okay with that? If anyone feels strongly against it and needs a sooner period, then I think we can vote on that.
So what are you saying, Dr. Drew?
So they have 60 days to suspend, to stop sales for 3 days in
3
total.
days out of the 60? or-
Yeah, yeah,
Yeah, I approve the 60 days.
Yeah.
That's reasonable.
yeah.
I approve that.
Yeah.
And just one thing, the inspectional department will come up with the specific days within that 60 days next week, and we will let the business know.
If it's all right, Ms. Buck, we spoke a few times. You can call me, and yeah, that's fine. I'll take accept service for my client. And thank you.
Yep.
And then regard to the inventory, do you want them to take the inventory out on those days, or can we just lock the door?
Yeah,
Thank you,
I
Mr.
think it's
Walsh.
reasonable just to lock the door,
Yeah.
yeah.
Okay.
Thank you.
Jared, Attorney Huckman, I just want to reiterate, with the 3-day suspension where this is 100% of his business, that tobacco business, I just want to reiterate that if there are any violations during those suspensions days, then there will be bigger consequences to pay. So I know I have some history here, and but I don't want to see that happen.
Through the chair, understood, Mr. Wells, and concur. I agree with you. I mean, if we have multiple, or subsequent offenses, the fine should increase. The penalty should grow. Thank you again for your consideration.
All right, thank you. So next is going to be a review request to update the regulations restricting the sale of tobacco and vape products. And we're going to have DJ Wilson and Lisa Stevens-Goodnight and Bonnie Carroll speak today. Thank you, guys.
Just as a note, you should probably have a vote on that consecutive business day. I do personally think that the state law would rule that, but just make sure you have a vote to make sure that happens. So I believe you got a sample draft regulation,
Yes.
and that draft regulation will have yellow and green highlights in it. The yellow highlights are from the state law and from the CMR regulation that was just referenced in the last conversation. And so the reason that and we know that every time we play around with these regs, we make them longer. But the reason for putting them in is to have it, as lawyers would call it, in the 4 corners of the document. So when you hand this regulation to a retailer, they don't need to look up state law. They don't need to look up the CMR. They can just go, the regulation talks about everything that they're supposed to abide by as a retailer. It also conforms a bunch of, for years we had definitions that slightly differed between state law, CMR, and local regulation. And finally, all three are in agreement. So if you see definitions that are in yellow, it's just to make them agree. In the green part, those are purely local policies that require a local decision. So the first decision is if you want them in your draft or not, and then later on you would decide if you wanted to include them into the final regulation. Some of these green additions are minor and really just go to making things a little clearer or updating existing language that was affected by the state law, or it helps Bonnie do enforcement. Others require a little more thought into them. And so Revere is unique in that you had years ago a establishment in town, they still exist, that sued the city, and the city went into an agreement with them. And so that agreement Lisa has been working on with the city solicitor and got and received it today, as yeah. So she'll talk about that.
I actually printed it off twice, so I have many copies if anybody wants one.
I'm going to stand over this way. Sure.
So yeah, there's just some things that Revere is held to that other states aren't, or other cities aren't in the state under this agreement. It just looks like there's actually two. So when the agreement was first put into place, it was in response to regulations that have been put in place. So it appears that the board really wanted to stay as far away from the things that were in the agreement as possible. Under my reading, there's a little bit more wiggle room if you want to go closer. As I said, I mean, that just is kind of, I think, a decision you guys have to make. So the two things that are that were in that decision, were in the agreement, are that you won't ban the sale of blunt wraps, and that the sale of a 2-pack of cigarettes shall be no more than $2.50. So we generally, right now, have been recommending $2.90, and then the price beyond that was for $5, because that would just be twice that. So that was the thing that was held to. The $5 is not actually in the agreement, so that's one area that there is a little bit of wiggle room on. But obviously, I think that for obvious reasons, they just settled a case. They probably didn't want to go near that at the time.
Part of this just had to do with what was happening around the state with these regulations at the time. So, you know, these regulations are constantly evolving, and we hope there's no state law action in the near future, so we can have things settle down. Even though you probably heard the feds are acting on a couple things in the last 48 hours. So this is something we do always recommend that cities and towns have their local attorney look at the final draft before it goes into effect, but you should certainly have that happen here with the city solicitor's office because of this agreement.
And I spoke with him. I believe someone on your board also spoke with him, and is expecting a call on this if you guys need any guidance from him. He knows this is something that's coming up, so he's happy to help.
So, a couple of the one of the green things that happens is that down in the penalty section, this does have the higher, well, it's actually in yellow, I believe. It blows up the penalty section into two sections, which is one, those policies that are under state law and get the higher dollar amounts, and those that are purely local policies and get the lower dollar amounts, the ones that you currently have. You'll see after that, there's a chart that lists on the left side those policies that get the state law amounts, and on the right side, those policies that get the local penalties. So that's to make it very clear to your retailers what if they violate in the left column, that's why they got the $1,000 fine. If they violate in the right column, that's why they got the lower local fine. The state law does use a 36-month tolling period, and I don't recall if you already had a 36-month tolling period in your old regulation or not. But we do recommend that jive too, just because it makes life a lot easier for both the health department and for Bonnie to do enforcement if the tolling period's the same. So that's something. One thing I'll just throw into this mix is that we do have a handful of cities and towns that have decided that the whole regulation shall be subject to the higher set of fines. And so it just would get rid of that chart, because everything in it would be at the higher level, and it gets rid of your, the section that lists your local fines.
Great, thank you. So we'll be meeting with the solicitor.
Can I just ask one
Sorry.
question? I know I'm not on the board, but.
No questions if you're not on the board, no.
This first page, the checklist for policy decisions, can you explain, is this, if we did check yes or no for any of these things, are they also written in like later pages? Or is this a separate thing that we would be deciding on, this very first checklist?
I don't have a copy with me, but I believe that they're already included.
Okay.
Maybe, oh, I don't even
Yeah,
know.
that's just, I think that's just for ease for us, honestly, because we
Okay.
can, that
If-
way we know what you voted yes and no on.
Yes,
Okay.
I mean, just if we overstepped in the draft and you, for some reason, wanted something that was easy, more lenient in the regulation, the board did, then we can deal with that. And then I think they have shall. Do they have shall already?
I don't have it with
Okay.
me, I apologize.
That's okay.
Yeah, I can look it up.
Nope, I
We
can,
just-
it's
I
awesome.
think they do have shall, because that's what the issue is.
Okay, so it's just, some of them are just to remind you what you have, so to make sure that you're still good with it and happy with it. And so that was it. There's some other colors I failed to take out, by the way.
No, that's just because of the court case. That's-
Oh, the
those are
court
for my
case? All right,
reference.
okay, very
Sorry.
good. You do... You use shall. We prefer shall for boards of health to use. That way you don't, frankly, that you don't give yourself wiggle room, so you don't have unfair enforcement for retailer A compared to retailer B. And then you get yourself in legal trouble by doing so. So the shall just says, nope, this is the regulation, that's the way it goes. So we do put that in just to double check to make sure that you're on the right, that it's still valid. In fact, this is a brand-new board since I've last been here, I believe, so.
Any other questions? I think that's it.
Okay.
Thank you guys for coming. I really appreciate it.
Yeah, thank you.
Yes, sorry. Last thing is we will have a public hearing for these regulations. So that will be at our next meeting in July for the Board of Health. So this is open to the public, and we can discuss kind of the next steps approving these regulations. Thank you. Meeting adjourned. Great. Thank you.